12 warning signs of colon cancer. Welcome everyone. In this video, we are going to dive into the top warning signs of colon cancer. Colon or colorectal cancer is a malignant growth originating in the colon or rectum. Typically, it originates from non-cancerous growths called polyps found on the inner lining of the colon or rectum. Colorectal cancer is a significant global health issue, impacting millions. Nevertheless, the precise causative factors of colon cancer remain intricate, and other factors such as genetic mutations, lifestyle factors, and family history are key contributors. Early detection of colon cancer is important for successful treatment. In this video, we'll explore 10 common symptoms of colon cancer to help you recognize these signs in yourself or those around you. Number 1. Weight loss. Weight loss can be a sign of a healthy lifestyle, and to some people, it's a positive achievement. But it is also an indicator of underlying health issues, especially when there is unexplained weight loss. And one such concern is colon cancer. Severe weight loss is frequently associated with changes in metabolism or reduced calorie intake, and the mechanism in the case of colon cancer can be rather complex. When cancer tumors develop in the colon, they obstruct the passage of food through the digestive tract, leading to diminished nutrient absorption and unintended weight loss over time. A retrospective analysis published in the Journal of Clinical Oncology revealed that many individuals diagnosed with colon cancer experienced weight loss in the months following their diagnosis. This suggests that weight loss might serve as an early marker for the disease. Cancer cells consume energy at a faster rate because they have a much faster metabolic rate than normal cells. Their increased metabolic growth is due to uncontrolled growth, contributing to weight loss. Apart from that, there are also psychological factors that are associated with this. Emotional distress and anxiety associated with a cancer diagnosis can lead to appetite suppression and changes in eating behaviors. All of this can also contribute to weight loss. All said, unexplained weight loss can be an important indicator of underlying health issues, including colon cancer. Number 2. Fatigue. Fatigue can also be indicative of colon cancer. But first, you have to know that fatigue is a nonspecific symptom because it can be a sign of various underlying factors. Still, when we talk about colon cancer, these symptoms may arise due to the impact of the tumor on the body's energy balance. Colon cancer can cause chronic inflammation, which occurs due to different factors. Still, one primary cause is the presence of abnormal cells or precancerous lesions in the lining of the colon, leading to the production of cytokines. Cytokines are proteins facilitating cell communication to regulate immune responses. In colon cancer, inflamed cancer cells release signals that trigger immune cells to produce cytokines. This can attract more immune cells, causing tissue damage and fatigue. Additionally, colon obstruction by the tumor can hinder nutrient absorption, further contributing to fatigue. Number 3. Rectal bleeding. Rectal bleeding is a symptom characterized by the presence of blood in the stool. It can be concerning because it can indicate an underlying health issue, including colon cancer. Rectal bleeding can arise from various sources, including hemorrhoids, which are swollen blood vessels located in the lower rectum or around the anus. And when these vessels become inflamed, they lead to rectal bleeding. Hemorrhoids are also caused by increased pressure in the veins of the rectum due to straining during bowel movements. Another source of rectal bleeding includes anal fissures. Anal fissures are small tears in the lining of the anus. They can be caused by passing hard stools. As colon cancer often occurs due to the presence of tumors or polyps in the colon or rectum. These growths can bleed when they come into contact with stool as it passes through the intestines. Furthermore, tumors can cause changes in the normal functioning of the colon, leading to blood mixing with the stool, which may not always be visible but can still be detected through medical tests. It's important to note that not all instances of rectal bleeding are indicative of colon cancer, but it is one prominent sign. Number 4. Anemia. Anemia is a blood disorder characterized by reduced red blood cells or hemoglobin in the blood. This can lead to reduced oxygen-carrying capacity of the red blood cells. Anemia can result from different factors, such as nutritional deficiencies, chronic diseases, and genetic disorders. It can also indicate a more serious underlying health issue, including colon cancer. In colon cancer, there may be gastrointestinal bleeding which can erode blood vessels, leading to slow, chronic bleeding that may go unnoticeable. This ongoing blood loss can gradually reduce red blood cell count and hemoglobin levels, causing anemia. The blood loss can be so gradual that it might not cause noticeable changes in stool color, making it harder to identify without medical tests. Colon cancer-related anemia has distinct characteristics that differentiate it from anemia caused by other health disorders. In cases of anemia linked to colon cancer, the anemia is typically normocytic, meaning the red blood cells are normal size, and normochromic, meaning that the hemoglobin content in the cells is normal. It is also important to know this because early detection of colon cancer through the identification of anemia can significantly improve the prognosis for patients. Number 5. Abdominal swelling. As colon cancer progresses, it may infiltrate nearby tissues and spread to other organs, leading to more severe symptoms and complications. And one of which is abdominal swelling. Abdominal swelling is another collective symptom of colon cancer. It is caused by different factors, such as physical obstruction created by the tumor. As the tumor grows, it narrows the passage for stool and gas to move through the colon. This can result in a backup of waste material, leading to colon distension. Moreover, growths within the colon can incite inflammation and fluid discharge, contributing to abdominal swelling. Fluid buildup in the abdomen may transpire due to several reasons. First, irritation from cancer cells prompts excessive fluid production in the abdominal lining. Second, blockage of lymph nodes in the abdomen hampers proper fluid drainage. Third, cancer spreading to the liver elevates pressure in nearby blood vessels, leading to fluid release. Lastly, insufficient blood protein production by the liver causes fluid leakage from veins into the abdominal cavity. Upon confirmation of colon cancer as the underlying cause of abdominal swelling, treatment strategies can be pursued immediately. Abdominal swelling can indeed serve as a significant sign of colon cancer. The presence of this symptom, alongside other related indicators, assures a comprehensive medical evaluation to determine the cause and potential presence of cancer. Number 6. Gas or bloating. Gas and bloating are common digestive problems, and they can often be attributed to diet, lifestyle, or gastrointestinal disorders. Still, in the context of colon cancer, it might be an indicator of the disease during the process of digestion. Gas is produced when bacteria in the colon break down undigested food. When the gas is produced, it can be released from the body in a few different ways, such as bleaching. This is when the gas is released from the stomach through the mouth. This happens when you swallow air while eating or drinking. Gas can also exit the body through flatulence. Gas moves through the digestive system and is released as flatulence, commonly referred to as passing gas or farting. The frequency can vary based on factors like diet and digestion. Bloating refers to a feeling of fullness, tightness, or swelling in the abdomen. A sensation of increased abdominal pressure and discomfort often accompanies it. Bloating may arise from various sources, including digestive procedures, dietary selections, and fundamental health issues like the buildup of gas due to intestinal digestion, expansion of the intestinal lining, and slowed stool movement in cases of constipation. The mechanisms through which gas and bloating arise as signs of colon cancer are due to tumors obstructing the colon. These obstructions disrupt the natural movement of gas and stool through the intestines, leading to uncomfortable symptoms. Additionally, the body's immune response to the growing cancerous cells might contribute to inflammation, further exacerbating gas and bloating. Number 7. Iron deficiency. Iron deficiency is another symptom of colon cancer. You see, iron, which is an essential mineral, is crucial in producing hemoglobin, a protein in red blood cells that transports oxygen from the lungs to different tissues. In colon cancer patients, the disease and its treatments, like chemotherapy, can disrupt the body's iron balance. Tumors can secrete inflammatory cytokines that interfere with iron absorption and utilization, further aggravating the deficiency. The relationship between iron deficiency and colon cancer extends beyond the disease. Research suggests that iron deficiency could also influence the development and progression of colon cancer. Iron deficiency may create an environment conducive to cancer growth, as tumor cells often require significant amounts of iron to increase. By limiting iron availability, the growth of cancer cells might be impeded. Also, severe iron deficiency leads to anemia, and in frail colon cancer patients, fatigue and decreased quality of life are usually experienced. Iron deficiency is a prominent symptom of colon cancer, and it is a multifaceted concern that goes beyond a mere nutrient imbalance. It impacts the progression of the disease, affecting both the patient well-being and treatment outcomes. Understanding the interplay between iron deficiency and colon cancer is pivotal for providing comprehensive care to affected individuals. Number 8. Nausea and vomiting. Nausea and vomiting are other symptoms of colon cancer. This happens because colon cancer primarily affects the large intestine, colon, and rectum. When a tumor grows, it can partially obstruct the passage of stool through the intestine. This obstruction can lead to a buildup of intestinal contents, causing discomfort, nausea, and even vomiting. Also, the pressure and discomfort in the abdomen due to the tumor's growth can trigger these symptoms. As the tumor obstructs the intestine, it could lead to difficulty in proper digestion and movement of food, contributing to feelings of nausea. Another cause of nausea and vomiting in colon cancer is related to the spread of the cancer cells. When these cancerous cells spread to other parts of the body, such as the liver, it can affect the body's ability to metabolize and process toxins. This can result in a buildup of waste products, leading to symptoms like nausea and vomiting. Nausea and vomiting can be associated with colon cancer, but they are not the most common or distinctive symptoms of the disease. But it can be a major concern if it persists along with some other symptoms we have mentioned earlier. And number 9, changes in bowel habits. Drastic changes in bowel habits can raise concerns in a person's health, and symptoms such as persistent diarrhea and constipation should not be ignored. These changes can signify not only colon cancer but also other gastrointestinal disorders. The connection between changes in bowel habits and colon cancer lies in disrupting the colon's normal functioning due to cancerous growths. Tumors can obstruct the passage of stool, leading to constipation. Almost 2/3 of people with colon cancer, 65%, experience changes to their bowel movements. That's why recognizing the significance of these changes and seeking timely medical evaluation is essential for diagnosis and appropriate treatment. This can also help prevent the progression of colon cancer. Don't ignore your bowel pattern. The time spent passing stools and consistency can be warning signs of the disease. Number 10. Bloody stools. The term narrow stools refers to stools that are thin or ribbon-like in shape. It can indicate an underlying medical condition, like colorectal cancer. It happens due to problems with the colon, such as blockages, growths, and mechanical impediments, as the passageway within the colon may become more restricted when colorectal cancers spread, which could affect the size and shape of the feces. Some people may notice a change in their bowel movements due to this mechanical constriction, which could cause stools to become narrower than usual. The presence of thin stools is not always a sign of colorectal cancer. Other illnesses, like anal fissures or hemorrhoids, can also cause changes in stool appearance. The presence of polyps is also another potential link between thin stools and colorectal cancer. The colon may become home to aberrant tissue growths called polyps. While most polyps are harmless, some could eventually develop into cancer. As these polyps develop, they may alter the internal colon passage's size and shape, possibly resulting in narrow stools. Regular polyp detection and excision are critical for preventing the growth of colorectal cancer because they can significantly reduce the risk of the disease. Also, colon inflammation may play a role in the emergence of colorectal cancer and the formation of narrow stools. Chronic digestive tract inflammation, especially the colon, is a feature of diseases including ulcerative colitis and Crohn's disease. Narrower stools could come from changes in the colon structure and function triggered by inflammation. Long-term inflammation has also been linked to a higher risk of colorectal cancer. To check for potential malignant alterations, thin stools in people with inflammatory bowel diseases may require closer medical evaluation. Keeping an eye out for changes in bowel patterns becomes more crucial due to the link between narrow stools and colorectal cancer. It's also important to recognize the significance of noticeable alterations in stool texture, frequency, and appearance. If you experience consistent or unexplained thin stools, it's essential to seek medical assistance. Detecting colorectal cancer at an early stage significantly enhances the likelihood of successful treatment and better results. Number 11. Abdominal cramps. Abdominal cramps are sharp, intermittent discomfort in the abdominal region. These cramps can be caused by a variety of factors, ranging from simple dietary mistakes to more serious disorders such as infections or inflammatory diseases. Among the numerous underlying causes of abdominal cramps, colon cancer is a common contributor. Colon cancer may arise as a result of aberrant cellular proliferation that occurs in the colon. As I said before, while there are many causes of stomach pains, they can potentially be a precursor to colon cancer. The anatomical and physiological changes that occur within the colon when cancer is present explain the link between stomach cramps and colon cancer. As the tumor grows, it may hinder stool passage through the colon, resulting in partial or full obstructions. This obstruction causes discomfort and cramping as the colon's muscles try to push the stool past the tumor. Furthermore, the tumor may produce inflammation in the colon's lining, resulting in further stomach discomfort. Colon cancer-related abdominal cramps are frequently described as chronic, intensifying over time, and recurring in predictable patterns. While occasional cramps may be caused by other causes, such as dietary choices or brief digestive issues, persistent and unexplained cramps should be cause for concern and immediate medical evaluation. Furthermore, cramps accompanied by other symptoms, such as changes in bowel habits, unintentional weight loss, or blood in the stool, suggest a sign of colon cancer. The physiological mechanisms underlying the link between stomach cramps and colon cancer are very complex. The colon's principal purpose is to absorb water and electrolytes from the remaining indigestible food particles, turning liquid waste into stool. In colon cancer, the tumor's growth can interfere with the colon's natural peristaltic movements, essential for driving stool forward. This disturbance in mobility, combined with possible obstructions induced by the tumor, causes cramping as the muscles try harder maneuvering around the blockages. In addition, colon cancer can cause an inflammatory response within the colon. The body's immune system is stimulated as tumor cells expand and infiltrate adjacent tissues, resulting in an influx of immune cells and inflammatory chemicals. This inflammatory environment can irritate the delicate nerve endings in the colon lining, causing abdominal cramps. In all, abdominal cramps can be caused by various underlying conditions. Their link to colon cancer is considerable and still needs further investigation. Individuals experiencing chronic or inexplicable cramps, especially with other troubling symptoms, must seek medical attention immediately to rule out dangerous illnesses such as colon cancer. Regular screenings and health awareness can help with the early discovery and successful management of colon cancer, thereby increasing the quality of life for people afflicted. Number 12. Loss of appetite. Loss of appetite, often known as anorexia, can result from a variety of factors, including colorectal cancer, which has the potential to alter appetite. When colorectal cancer develops in the large intestine or rectum, it can have systemic consequences on the body. Colon cancer consumes energy and nutrients, diverting resources from normal biological functioning. This divergence of resources might result in feelings of exhaustion and weakness. Because emotional responses can tremendously impact an individual's appetite, psychological mechanisms also contribute to the link between colorectal cancer and loss of appetite. Changes in appetite-regulating hormones and neurotransmitters can be triggered by stress, worry, and sadness, resulting in a decreased desire to eat. Furthermore, the physical symptoms of colorectal cancer can reduce an individual's willingness to eat. You see, colorectal cancer is frequently accompanied by bowel abnormalities such as diarrhea or constipation. These symptoms might cause discomfort, cramps, and agony, reducing the enjoyment of eating. As a result, people may develop an aversion to food to prevent intensifying these unpleasant sensations. The link between appetite loss and colorectal cancer can also be traced back to the effects of cancer treatment. Colorectal cancer is commonly treated with chemotherapy, radiation therapy, and surgical treatments. Unfortunately, these treatments can cause various side effects, such as nausea, vomiting, and alterations in taste perception. Nausea and vomiting can directly impact appetite, while changed taste perception can make meals less appetizing. These adverse effects can create a vicious cycle in which cancer therapy unwittingly increases appetite loss. It is important to know these warning signs, as ignoring them may lead to later stages and development of the disease, making treatment even more difficult. Promoting awareness and understanding the risk factors are critical to preventing and controlling colon cancer. And understanding these symptoms can help you and the people around you have better control over your health. If you found this video helpful, leave us a like and subscribe to our channel for more educative information. Also, don't forget to turn on the notification so you don't miss our next video. Thank you for watching, and we'll catch you in the next one.